Alright, hi, my name is Dr. McAllister, and I recently had the opportunity to go down to Mexico with a group called the Gift of Life. The Gift of Life is an organization through the Rotary Club that collects donations and sends doctors down to Mexico to service underserviced populations in Mexico. So, particularly in this case, it's pediatric populations with heart conditions. So every 2 years they go down to the capital of Sonora State, the city of Hermosillo, and they provide care for the children there, and will refer out for surgeries if necessary, perform tests in office, and routine checkups, maybe prescribe meds at the same time. So that's the group that I went down with. They're a fabulous group of people. 2 of the doctors are pediatric cardiologists out of Tucson, really wonderful people. We had a bunch of support staff on hand. We had interpreters, we had volunteers from the local high school. People were so overwhelmingly happy to have us there and so appreciative, because these kids otherwise wouldn't get normal checkups, any kind of care. And in a lot of cases, these kids without proper care probably wouldn't last too long. So it's a fabulous organization. I would highly recommend people looking into it, and they do a lot of good work. Alright, so the organization, when we flew down, we first got settled in our hotel. And then for all day Friday and all day Saturday, we were transported to a hospital, and we essentially occupied a whole wing of the hospital. So the way it worked is I was the first point of contact for all the patients. So they would come in, and I would essentially triage them as to what their necessities were, which doctor they would see. At the same time, I'd also, if I could, figure out if they needed any tests that I could run. For instance, I was given the task of running the EKG machine. So the kids would come in, I would see them, I would talk to them a little bit, either with broken Spanish or through an interpreter, and take their vitals, and then, if necessary, perform an EKG. Then go conference with the doctor about what they might need or how soon we need to see them, and then they would get filtered on to the doctor. So in the course of 2 days, I saw 52 kids, which for me was unbelievable, because I haven't had a lot of exposure to kids, and I haven't had a lot of exposure to cardiology. But in the course of those 2 days, I saw so many textbook amazing cases of cardiology pathology. So, different types of murmurs, different birth defects, different serious conditions, some more benign, some kids that needed immediate surgery, some kids that had already had surgery. So it was a really amazing experience to get that whole spectrum of cardiac pathology. And at the same time, the doctors that I worked with were excellent at sitting down with me and discussing the relevance of what we were hearing, the different findings, what it means if you feel a thrill on a child's chest. They were really wonderful teachers. I really couldn't ask for better support, and it made me feel so much more comfortable working with kids and with cardiology complaints. So probably some of the more interesting things that I saw when I was down there were some of these more advanced pathologies that you kind of read about in textbooks, but I had never experienced before. So conditions like tetralogy of Fallot, I saw ventricular septal defects, I saw atresia of the pulmonary vessel. These are things that I never would have seen if I hadn't gone down there. I mean, maybe if I'd spent a long time in a cardiac unit, I would eventually see these things, but a lot of these things are corrected from birth, and so in the United States, you're not going to necessarily run into a kid with these. Another really interesting thing that I saw is a condition called Marfan syndrome, where people grow really, really tall and they have really long fingers, and typically will have eye problems and heart problems. And it's a connective tissue disorder that I'd read about, but I had never seen it. So that was really a treat to see that. So probably all of those pathologies, I got to see kids that were cyanotic because their hearts weren't working properly, they weren't perfusing into the peripheral circulation, blue lips, spooning of the fingers. These are more advanced conditions that I had never seen before, and I don't expect to see that often in this country. But down there, these are kids that were really in need and didn't really have the follow-up and the care that they needed, so that's why they were coming to us. So it afforded me that opportunity to really see a lot of these advanced pathologies, and that was an incredible learning experience. So basically, if people wanted to be involved in this organization, either with donations or actually volunteering, you can go on their website, just do a search online for Gift of Life, and they would be happy to take donations. They're a wonderful organization, and they send doctors to all over the world. I know one of the doctors that I worked with had spent time in Ethiopia, and that same doctor is going to be spending time in El Salvador. So they send people all over it's helping those populations that really don't get the care otherwise. Now, this particular trip that I did, if people are interested in volunteering on that, that's a once every 2 years deal. So you'd have to contact Gift of Life and see if you could get on the next 2-year follow-up. But it's a fantastic time. Everyone who was involved were just such wonderful people. The Rotary Club, when we were down there, the members that were involved in the Rotary Club, they took such good care of us, and they had a big fiesta for us, and everyone was so grateful. The patients were so grateful. The patients' parents were so warm and thankful because they don't get this kind of care otherwise. So it's a fantastic organization. I would highly recommend you all get involved.